Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about the best way to document MCAS. MCAS stands for mast cell activation syndrome, and it's characterized by a number of different symptoms, and it's in every organ system. But it's basically when the mast cells are overproducing histamine. Unfortunately, when you capture histamine in the blood, oftentimes it is not abnormal. There are not abnormal levels because histamine degrades very quickly. And so you are not able to capture the excessive release of histamine. So according to Dr. Dempsey, who is she's a mast cell expert, she says that one of the best ways to document MCAS is to have a measurement of heparin in the blood. Heparin is a blood thinner. It's a naturally occurring blood thinner in your body, and it is released by mast cells along with a lot of other cytokines and chemokines, such as histamine and tryptase, but neither of them hang around for long enough for them to be appropriately captured. But heparin does. So one of the best things to do is to just run a heparin test through LabCorp. I don't remember what the LabCorp code is for it, but you can run a LabCorp code and a LabCorp for heparin, and then if it's positive and the patient's symptoms correlate with what you're doing, with what you're looking at and what you think is going on, then that corroborates, that acts as support for the diagnosis. Now, as a naturopathic doctor, it is not critical that I get an MCAS diagnosis. I can use other things like allergic rhinitis or gastritis or any of the myriad of things that MCAS can cause. But when you want to use immune modulators, heavy-duty immune modulators, you are probably going to have an MCAS diagnosis, and you are going to have labs that support that. So that's why it's important that you do get a proper MCAS diagnosis and not just put allergic rhinitis or gastritis or any of the myriad of things that MCAS can cause. Interestingly, Dr. Dempsey said that endometriosis and excessive bleeding in women that are that have their menses can be related to mast cell disorder, because what happens is the mast cells degranulate, they dump heparin into the body, and it causes blood thinning. And that's why women bleed so much. I thought that was so interesting. I didn't put those two things together. So heparin is a measure of MCAS, and it's a blood thinner. And so, in people who have really serious menses and menses bleeding, likely there's an underlying MCAS issue. And so you're going to want to use MCAS, mast cell stabilizers like cromolyn sodium, LDN, Zyrtec, Allegra, ketotifen, those kinds of things to help. Even DHIST, HIST-DAO, these are all really important things. So they really help stabilize the mast cells and get the histamine back down. And the reason you want to do that is because histamine is so inflammatory. It's like pouring gasoline on an existing fire. So you want to get that calmed down. So I hope you found this to be helpful, and I hope you have a wonderful day. Take care.